Thank you very much to everyone for dialing in. We're going to wait just a couple more seconds as more people continue to join us. All right, good morning or good afternoon, depending on your time zone. My name is Sarah Seeloff. I'm the Executive Director of the Center for Creative Land Recycling, coming to you from Oakland, California. It is our pleasure today to offer this National TAB webinar. For those of you who are familiar with the TAB program, you'll recognize the technical assistance to brownfields communities providers as the Center for Creative Land Recycling, covering regions 2, 9, and 10, Kansas State University, covering regions 4 through 8, and the New Jersey Institute of Technology in regions 1 and 3. And for those of you who are new to the TAB program, we are a group of technical assistance providers who work directly with communities across the country to help advance brownfield redevelopment. It is in our work with the US EPA. I think many of us have gotten to know different offices. If you're coming from a brownfields redevelopment perspective, you're no doubt familiar with the EPA brownfields program. But what you may not know is that there are many other offices within EPA that are doing some phenomenal work, and it's our pleasure today to highlight programs from the Office of Community Revitalization. I have had the pleasure of working with the Office of Community Revitalization on a number of occasions, and it is with great pleasure that I'm going to pass we have one, before I pass the baton, we have one quick polling question. So in order to help our speakers understand the geographic diversity of our listeners, tell us where you're calling in from. In what EPA region are you located? Gonna give it a couple of seconds here. Okay, it looks like about 40-something% of you are coming from regions 4 through 8. So you might know Kansas State University. About 20% of you are coming from regions 1 and 3. So you may be familiar with NJIT and have worked with them. And then 15% of you are coming from CCLEAR's regions in EPA regions 2, 9, and 10, and 25% are not sure. So very helpful, thank you. We'll do a couple other polling questions throughout the presentation. But without further ado, I'm going to pass the baton to Chitra Kumar, Director of the Federal and States Division for EPA's Office of Community Revitalization, and she's going to share with us some excellent information about their work. Chitra, take it away.
Thank you so much, Sarah, and thank you so much to the TAB family for allowing us to be here today and present about Office of Community Revitalization and our programs. Today, right before I kick it off, I wanted to do one more polling question about your awareness of our programs. So before I spill all the beans, tell us if you already know something about us. And while you're doing that, I'll go ahead and just introduce my colleagues. So as Sarah said, I'm the director of one of the divisions, the Federal and State Division in the Office of Community Revitalization. I'm joined here with two of my senior colleagues here, Stephanie Bertaina and Melissa Kramer, both of whom who have run our technical assistance program in this office and have been doing so for many years. So we appreciate being here. All right, so I'm interested to see here that the majority of folks are not very familiar with us, and so you will learn a lot today, we hope, and are starting off with our next slide. What we'd like to do today is go ahead and give you a little bit of a flavor of what our office does, why we do it, and with a focus on a couple of our planning assistance programs and tools, namely the Local Foods, Local Places program and the Healthy Places for Healthy People program. And we find that the best way to explain what we do and how we do it is to tell stories from the communities that have taken advantage of the assistance that we provide around revitalizing communities and downtowns. So let me go ahead and start off with about our office. I'm trying to advance the slide. All right. So, our mission in the Office of Community Revitalization is to support locally led, community-driven development strategies that protect the environment, expand economic opportunity, and revitalize neighborhoods. And if you've ever wondered why EPA would do this, just as a reminder, our mission is to protect human health and the environment. And we know from decades of research that how and where we build communities affects land, air, water, quality, and health. And helping communities reuse existing buildings and infrastructure and revitalize neighborhoods brings economic and quality of life benefits, while also using resources wisely, preserving undeveloped farmland and open space, and reducing pollution. So our office is situated in the Office of the Administrator, the Office of Policy, and as such, we have a cross-cutting role in working across the agency, and we work in a really voluntary assistance way, recognizing that most of the decisions that happen around land use happen at the local level. And so we really work hand in hand with communities, offering them on-the-ground technical assistance. And we also provide publications, research, and tools that communities can use to set goals and make more informed decisions about how and where they grow and develop. And these tools and the research really comes from that on-the-ground experience so that it can be transferred. Now, after the Great Recession, we realized that some of the growth that we took for granted beforehand, it wasn't a given anymore. So many of the communities we started to work in needed more support to stabilize their communities, their economic situation, and even reverse economic decline. So by working in these distressed communities, we honed in on what we call a method that supports economic diversification as a strategy to address environmental protection. The method manifests itself in the form of planning assistance, where we really bring together stakeholders using our convening power. So that includes tribal, state, regional, and local governments and community organizations to help them have conversations about their own priorities and their vision for the future. And most of this work that we do is in partnership with other agencies or other organizations. So we coordinate across EPA using our role in that cross-cutting way, and also with other federal agencies. And some of our federal agencies are the most important partners we have in order to ensure that communities can use federal programs to meet multiple local goals, including improving health, clean air, land and water, and economic growth. So I'm advancing to the next slide. So there's a little bit of a delay, so my apologies there. So this is a map of our technical assistance. Over the past 20 years, we've worked in hundreds of communities in all 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands. And we've done this through a range of programs, out of which today we're going to focus on two, but just to let you know that we've worked in a lot of different issue areas over these years. Right before I move on, I'd like to pull up one more polling question. Just to get a sense of where you all are from and where you might fit on this map. It'd be great to know, what is the community population size that you're from?
Chitra, this is Sarah. While we're waiting, there seems to be a bit of a microphone issue. We've heard a couple of comments about garbled sound. So if there's a way to get closer to the microphone or a different microphone, I just want to flag that for you.
Thanks, appreciate that. I just figured out that I may not have muted my mic. Is it help better now?
I think a little better. Why don't we go ahead and proceed, and hopefully things will resolve.
Okay, we're hearing back on the phone too, so it might be my connection. All right. So it looks like from the poll that the majority of folks, or 40% of folks, live in cities, bigger cities. Some folks live in some smaller cities, and then we do have a fair number of people, so over 40% that are in, depending on what you define as rural, but small towns or rural places. So welcome. It's exciting to know about, and we have experience in all sizes of communities, all the way from down to 500 people, all the way to neighborhoods and cities, major cities like LA and Detroit. So about a little bit about how we work. Again, advancing the slide. There we go. So a quick overview of what our method looks like. So communities apply for assistance through a competitive process. We work only where a community has asked for our help. We use a team of contractors and federal staff to work with the community to develop goals and concrete actions towards achieving them. The process generally centers around a 2-day facilitated workshop in the community on the ground. The solutions that we come up with are in collaboration really with the local leaders. They're driven by the conversation on those 2 days, and are tailored to the community's needs and resources. And we try to bring expertise into the room as a part of the contractor team and the federal resource to help the community in seeing what other types of activities are happening across the country under similar circumstances as that community.
Chitra, I'm sorry to interrupt again. This is Sarah. We're getting more comments that the audio is worse. Is there another line that we might be able to have you dial in on?
Why don't we switch to, do you think it's this phone?
Or if we could make sure that our co-hosts are muted, I think that might also help.
Okay. One other thing I could do is try my computer audio instead of the conference phone line.
Sure. And apologies to our listeners. As you know, sometimes technology is not as cooperative as we might all want it to be. Thank you very much, Chitra.
Okay. I'm switching over to my computer audio.
In the hopes that that will. Can you all hear me now?
That sounded clearer.
Okay.
And everybody is saying much better. So apologies for interrupting your slide. Let's get back to it.
All right. So a quick recap. We've worked in hundreds of communities across the country of different sizes and types. We work with the federal resource team and contractors to bring best practices and expertise and support the community as they come up with visions for the future. So before the workshop, I'm trying to go backwards on my slides, and somehow it just keeps advancing. All right, here we are. So the work is centered around a 2-day workshop. After the workshop, the community gets to decide, or during the workshop, there's a pretty detailed action plan that the community develops through our facilitated exercises. And we refine them in conversation with the community even after the workshop. And then we leave behind this action plan report that the community gets to decide whether and how they want to implement those actions. And we really use our convening power to help leverage the investments from other public and private sector partners to help them implement those ideas as best we can, or set them up with partners who can be helpful. So during the rest of this webinar, I want to lay out, or we as a group are going to lay out in more detail how this works. We'll use a toolkit from our Local Food, Local Places program and give you some more case studies. And in order to understand when I say local food, local places, what that means, I'm going to advance the slide to the next one. There we go. So Local Food, Local Places is one of our flagship programs, which started in 2013 and aims to increase economic opportunity, improve access to healthy foods, and revitalize downtowns and existing neighborhoods. We accomplish this by planning for a stronger local food system and connecting it to place-based investments in existing communities. Comes on. We've had a number of federal partners who've supported the program over the years, and we're about to announce the recipients of the current round of technical assistance. We had a solicitation at the end of last year that we're about to announce who was selected. Unfortunately, we can't say who they are today, but I can say that excuse me, the current program sponsors are EPA, USDA, and the Northern Border Regional Commission. Sorry, if I could get some help. There we go. Excuse me, advancing the slide. So this is a map of where we've been. We're excited that with this next round, this program will have assisted over 100 communities across the country, all of them very diverse. We know our method works because year after year, we've had strong demand for our assistance and continued interagency support. And not only have we seen it work in the food system space, but also in the health sector. So I'm going to turn it over next to Stephanie to describe our Healthy Places for Healthy People program. And just before I do that, we're going to have one more quick polling question. And while we're waiting on the polling question, are we still okay on the audio?
We are. Thanks so much.
Great. So we're just waiting for the results of the polling question. So we wanted to kind of see which of these focus areas your community is most interested in building on, including local foods and healthy living opportunities, outdoor recreation, which is a new focus for us. And it looks like healthy living is a big one, but followed by local food. Great. Thanks for that input. So Stephanie, take it away.
All right, well, thank you, Chitra, for giving that great overview of our office and the Local Foods, Local Places program. Again, my name is Stephanie Bertaina, and I work with Chitra and Melissa in the Office of Community Revitalization. And I wanted to share today a little bit about the Healthy Places for Healthy People program, which is one of our other technical assistance programs that our office currently offers. And Healthy Places for Healthy People is at its core a planning assistance program that helps community leaders and their healthcare partners, so community health centers, nonprofit hospitals, other partners, to really work together to create healthy, walkable, vibrant neighborhoods and downtowns. This program has been around for 2 years. We just finished the second round of our Healthy Places for Healthy People program. And essentially, the program aims to help communities work together to address their health concerns in a more holistic way. And so this program recognizes that healthcare facilities themselves can be economic anchors and catalysts for neighborhood and downtown revitalization efforts. It also recognizes that communities are looking to improve access to healthcare, fresh food, and physical activity. And it also recognizes that communities are looking to support health-focused entrepreneurs and businesses, thinking about the economic development implications of the healthcare sector, and to improve the built environment to really make it easier for people to live the healthy lives that they want to live. So this program, like Local Foods, Local Places, has been supported by a range of different federal partner agencies, and I think that's one of the unique elements of our technical assistance that provides value to communities. So HP2 has been supported by our office at EPA, the U.S. Department of Health and Human Services, Health Resources and Services Administration, the Appalachian Regional Commission, and the Delta Regional Authority. And we really do bring together even more than those supporting agencies together with our communities at the workshops as well. So we've had support from really a wide range of federal agency partners. And essentially, Healthy Places for Healthy People recognizes that in order to have a healthy community, you do need to have healthy people, and you also need to have healthy places and access and opportunity for all people to benefit from those places. So it's really a program that we've developed to work at this intersection between the environment, health, and the economy. So HP2 is also centered on the social determinants of health. And as I advance to the next slide, you'll see a picture of those. But essentially, the social determinants of health are really all of the factors that influence a person's health. And they're everything from economic stability, your access to a, sorry, still trying to advance the slide here. Give us 1 second. Okay, there we go. Okay, so you'll see the social determinants of health is sort of in that graphic that's in the rectangle box to the right. And really, many of you might be familiar with the social determinants of health. These have been around for many, many years. Our understanding of them continues to grow. But essentially, it recognizes that places really very deeply affect people's health. And it's everything from access to a quality living wage job, to your access to housing and transportation and parks in your community, to your ability to have a quality education. Of course, things like access to fresh, healthy, local food. It's also things like social and community connectedness. We're learning more and more the important role that community connection really plays to people's longevity. I recently learned that loneliness is akin to smoking 15 cigarettes a day, I believe is the statistic. So the health outcomes of loneliness and not being connected to each other is really impactful to our health as well. And of course, it's the healthcare system itself. It's, do we have access to quality, affordable, and accessible healthcare? So it's all of these factors. And as we were looking at them and all of the work that we've done with communities over the years, we realized that there are probably communities out there who want to tackle these issues in a really holistic way. So we organized Healthy Places for Healthy People around these social determinants of health. And you see the Healthy Places objectives graphic to the left of the screen. And this is really the tool that we use to help communities think through where are their strengths and their assets in all of these categories, and where are the opportunity areas that they have for growth in all of these arenas to really build a healthy place that's going to be supportive of the people in their community. And all of this recognizes that the burgeoning research that's showing that a person's zip code is as much a predictor of their health as their genetic code. So places matter, and that's what we tackle through HP2. So you'll see a map here of the 16 communities with whom we've gotten to work over the last 2 years. And you can see it's a wide-ranging group of communities from large cities like Los Angeles to really small towns in central Appalachia like Montgomery and Smithers, West Virginia. We've worked with community partners across the country through this program. We've worked with hospitals and federally qualified health centers and nonprofit partners and city governments and businesses and a range of stakeholders, all who are committed to building a healthier place where they live. So it's been a really amazing couple of years, and it's been a really inspiring program and an issue area that we've been pleased to see has really allowed communities to rally around. So to highlight both of these programs that we've described to you, Local Foods, Local Places, and Healthy Places for Healthy People, we wanted to share a couple stories from communities with whom we've worked. So to start us out, I wanted to talk a little bit about Williamson, West Virginia. And Williamson is a community that's near and dear to my heart that we've been able to partner with several times over the years. Williamson is a small town in central Appalachia. It's a community of about 3,000 people. It's a coal town. The primary economic driver in this community, as in many, for many generations, was coal. And as the coal industry has continued to decline, Williamson, along with many other communities across the country, suffered really decades of slow but steady economic decline. And with that economic decline came a lot of health challenges that emerged. So residents, as you can imagine, going back to the social determinants of health, faced a lot of challenges. And Williamson was seeing increased incidence of obesity and diabetes, severe health challenges that were really threatening their community. And so what the community of Williamson really has done over the last several years is to really change the narrative in this community to become a place that has a culture of health. So they're creating a culture of health in central Appalachia. And again, we've gotten to work with Williamson through our technical assistance programs over the years, including through Local Foods, Local Places in 2015. And through all of these interventions, we've learned a lot from Williamson, and we've helped Williamson along in their progress. So I just wanted to tell you a little bit about their story. So at the heart of Williamson's efforts is this federally qualified health center. So there's a federally qualified health center that decided to open a new location. And instead of locating on the outskirts of town, they said, we are going to locate in this formerly vacant building on our main street. We're going to help be part of the story of bringing Williamson back to life. And the Williamson Health and Wellness Center now organizes activities in the community around health, wellness, local food, and it's become this really strong anchor for economic development in the community. You'll see the Williamson Health and Wellness Center clinic up at the upper left-hand corner of your screen. And this is the building that was formerly vacant that they renovated and brought up to LEED environmental sustainability standards. They, again, located in a formerly vacant building that's now this beautiful space. They are adjacent to, next door to, a diabetes coalition, which you'll also see here. And the Diabetes Coalition is organizing walking programs and fitness classes, providing education around nutrition, and also coordinating a prescription vegetables program where patients coming to the clinic can redeem their prescriptions at the downtown farmers market, which you'll see on the bottom left corner of your screen. So Williamson has this downtown farmers market, and they've also created a mobile market to take fresh fruits and veggies out and around to the community that can't necessarily get to downtown Williamson. Further, they also have a commercial kitchen in the works that's being built downtown as well. You'll also see the Ramella Park Community Garden in your bottom right-hand corner of the screen. And this is a really special place too, where the community's banded together to create this growing space. It's actually across the street from a low-income senior housing facility. So residents in that facility can walk across the street and garden and grow their own food. Also at the Ramella Park Community Garden is a partnership with the Growing Warriors program, which is partnering with returning veterans and out-of-work coal miners to help them, give them the tools to become farmers and to raise a living in a new way for themselves. They've also been partnering with local entrepreneurs who want to start up businesses, like the restaurateur you'll see here, serving local food downtown now in a building that was formerly underused. And they've also created the Health Innovation Hub, which is another space downtown. You can see a trend that they've brought back to new life to create a co-working space and a support system for new business startups in the community. So Williamson has a lot going on, and we've been able to be a part of helping them along the way through the technical assistance that Chitra described. Williamson's a really inspiring story, and if you don't know much about Williamson, please do check out some of the links that we shared here. It's a really amazing community. I can't even keep up with all of the great things that they're doing, but they're a really shining example of a community that was in economic distress, frankly, and really created a new narrative for themselves through the energy of really amazing community members. So that's the story of Williamson. I also wanted to briefly just share another story with you from another community across the country in Wenatchee, Washington. So this is Wenatchee, and it's another really special place with wonderful people. It's a stunning place, as you can see. Central Washington, it's a small city of about 34,000 people. It's located and situated in this really rich agricultural region where there are lots of fruit orchards. So apples, cherries, pears are grown here. It's known as the apple capital. And it really has drawn a growing immigrant migrant worker community coming to work primarily in these orchards. And most of the immigrants are coming from Mexico. So in 2017, I guess they applied for assistance from Healthy Places for Healthy People. So Wenatchee was one of our communities with whom we got to work last year. And their application and the work that we did with them really focused on the South Wenatchee neighborhood, which is the neighborhood within the city where a lot of the growing immigrant population lives. In this neighborhood, there is a park, Kiwanis Metau Park, and it's been in the process of planning a renovation that's been spearheaded by the Trust for Public Land. And this process has been going on for years and was about to come to fruition. And the community saw HP2 as an opportunity to build on that investment that was coming into this neighborhood, a neighborhood which really had received not a lot of attention and had really experienced a lot of disinvestment over the years. So our project was aimed to sort of build on this investment and improve health outcomes and economic outcomes, frankly, for this community. So again, Wenatchee is a beautiful place. You can see some of the pictures here, just brimming with natural beauty, neighborhood character, and a vibrant culture, particularly in the South Wenatchee neighborhood. It's a place that's just got a wonderful sense of community, arts and culture and vibrancy that's there. And yet they've also experienced this disinvestment and have been left out of some of the fruits of the growth that Wenatchee has experienced. So, you'll see a picture of some of the orchards, which certainly provide a lot of employment for this community, but also there's challenges here too, as there are in many of our communities. You'll also see a picture of Methow Park on the bottom right-hand corner, and that's the park that's receiving this investment that the Trust for Public Land has been working very closely hand in hand with the community members to plan for. So you'll see the plans for the renovation that is underway now. And for many years, again, Trust for Public Land has been working with the community on the vision for this property, and it's really a catalyst investment. The whole effort has been spearheaded by community members themselves. So residents of the South Wenatchee neighborhood have driven this process, which has been facilitated by Trust for Public Land and other partners. A lot of the project is being funded by many community partners, including the local hospital and healthcare facilities, who are playing a role in this investment. Furthermore, as part of this process, there has been a really active group of neighborhood residents that have emerged. They call themselves the Parque Padrinos, and they're residents of the South Wenatchee neighborhood, and they are called Parque Padrinos because they are serving as the godparents of this park. And I wanted to show you just a picture of some of the Parque Padrinos. This slide credit goes to my friend Teresa in Wenatchee. She shared this slide recently at another conference, and I just wanted to share it with you all to say these are the people who are doing this work, and many of these folks are the folks that we worked with through HB2. So these are Parque Padrinos. These are the neighborhood residents and community activists in Wenatchee who are focusing their efforts on leveraging this park investment for broader health outcomes for the community. So we had the privilege and the chance to work with Wenatchee last year, as I mentioned, through Healthy Places for Healthy People. And we worked very closely hand in hand with the steering committee in Wenatchee of local community members, the city, the hospital, Parque Padrinos, and other organizations to really, again, build on this investment and to extend the health benefits throughout the South Wenatchee neighborhood. So our engagement with Wenatchee was really a two-part workshop. In September of last year, we held a series of events that were spearheaded by Parque Padrinos and our steering committee. And those included things like events at the park itself to ask community residents what are their health challenges and opportunities that they see, what are their barriers to living the lives that they want to live in their community. We also did outreach and engagement at a community festival called Fiestas Mexicanas, and you'll see a picture of that on the upper right-hand corner of the screen. And it was a tremendous opportunity to ask people, what is special about your neighborhood? What do you love about it? What is your favorite place? And what would you like to build on? And then in October of last year, we got to spend our 2-day workshop, which is our traditional model, 2 days spent in the community where the local steering committee brought together all of their community members, their stakeholders. We brought together the federal partners, state agencies, philanthropy and community development finance institutions and other partners to hear what the community's vision is for building on health improvements in the South Wenatchee neighborhood and to see how our programs and efforts and funding could help. So you'll see the goals that we ended up with through the workshop, and there are many, many goals that Wenatchee had. And I won't run through them in depth here, but all just to say that Wenatchee is off and running, and they've really tackled health in a holistic way there. They are establishing a community health worker program in the community and a park prescription program. They are working to promote public art and activate the street that connects the park to the rest of the city. They're supporting and sustaining small businesses, and they're boosting the Parque Padrinos group to really brand and elevate the voices that are part of that organization. And again, they've done tremendous work in just the months since we've been there. The groundbreaking for the park renovation is starting very soon. They're working to improve pedestrian safety through complete streets investments and infrastructure throughout the South Wenatchee neighborhood. And Parque Padrinos' voices are being elevated and are moving to action. They partnered with the Latino Community Fund of Washington in the fall to triple voter registration for Spanish-speaking people in the Valley, resulting in elections that of county commissioners who are supportive of the efforts of the South Wenatchee community. So just a little bit of a flavor of some of our communities so you can get a handle and a sense for what our assistance really looks like on the ground.
All right, thank you, Stephanie. I am going to talk for a little bit about the Local Foods, Local Places Toolkit. This is a document that we created after having worked with a large number of communities across the country with the Local Foods, Local Places program. And we thought we had such great tools developed to do that work that we wanted to share them with other places that are interested in trying to undertake a similar process on their own, recognizing that the program is going to be limited in the number of places that it can work with. It is a competitive program, and so we wanted to have something that anybody could use. So it's really a step-by-step instruction manual on how to plan and host a community workshop. The end result is the same thing that is the end result of our program, which is an action plan that lays out next steps for implementation. So I'm going to just walk you through a couple of the steps that we do in planning a workshop. The idea being that you would gain a little bit of confidence in hearing about what's in the toolkit and some of the tips and tricks that we've learned in doing this work, that you would really feel comfortable that you could take something like this and do it on your own. So the first step is that we organize a planning team. And there, it's really critical that we identify lead stakeholders who are going to not just do the bulk of the work, but also be the champions for the product when it's completed. So we spend a lot of time in making sure that we are working with the right people in the community. We work often with local governments or with nonprofit organizations, but we really want to make sure that if we're working with a nonprofit organization, that the local government is involved. We know that so many of the things that communities are going to identify as needed steps to achieve their goals are going to involve the local government in some way, if not outright permission or licensing, then at least support for what they're trying to do. And we also make sure that we are involving community members, the people that are intended to benefit from all of the actions that are going to be undertaken. And then next, what we try to do is define the scope of the effort. So we're looking for a geographic area that's going to draw participants that are closely and deeply connected to the place where we are, because we're really looking for place-based interventions. We know that regional planning is super important. We want what we do to feed into regional planning or build off of regional planning, but this process in particular is really focused on place, and so it's focused at the local level, meaning a small town or a neighborhood of a larger city. We're looking for an area that's small enough that you can really tailor the policies that can recognize that there are distinct land use patterns and purposes to different areas. But it's also important is we want it to be large enough that stakeholders can really look holistically at policies and programs. Sometimes what we see is we get a group of people together and everybody is on board. Yes, we're all about downtown. We're going to talk about our main street, this couple block area, but they're not really, they're leaving out of the discussion the investment that's going in a couple of miles outside of downtown and the ways that community policies and programs are incentivizing a different type of investment than what everybody in the room is talking about. So we want to make sure that the area is large enough that we're really encompassing the whole of the community where programs and policies are going to be implemented. And then next, what we do is as an assessment phase. This is the pre-planning phase for the workshop. And so we're looking at trying to understand both a qualitative and quantitative description of the conditions in the community. And we want to include the history of prior initiatives, what has happened in the community, because so many places where we've been, even very small towns, we find that a lot of the people there have planning fatigue. They've done this before, they've gone to workshops, and what they want to do is recognize that that past work, that past time that they've invested has been worthwhile. Maybe not everything was achieved, maybe not everything has been implemented. It doesn't have to be 100% success, but it has to be something that people have learned from, either to try a different strategy or to build on what has been successful and what they've done. We know that quantitative data is super helpful, but it's not always available, particularly in a lot of the rural places where we go, where data is collected at a county level. It shouldn't stop progress. It's helpful to have if you can get it, but don't get hung up on that. So we really then try to consider a whole wealth of information that's not traditionally part of an economic development plan. We might look at walk audits, cultural inventories, a look at the public transportation system, where it goes, where it doesn't, any kind of community values surveys, really anything that a community has done, because most places have some kind of information that's going to be important. We also have a tool that we call our community self-assessment. This is a document that's meant to start a conversation among the people who are planning the workshop. It's really designed to help them learn about where they want to focus their energy during this 2-day span, recognizing that not every possible goal is going to be able to be covered. And if there is an outside facilitator that will be brought in, it's also an important tool for that facilitator to understand where the community is and what the focus of the workshop should be. So the self-assessment has a number of different areas here. I think we've got 10. You can read those. These are focused on the Local Foods, Local Places program, but many of them obviously have applicability to a whole host of different types of economic development plans. This is just showing what a sample of the self-assessment looks like. So it takes a given topic. It asks you to consider kind of overall, how far along are you in this general area? Is it something that you're just beginning? Or is it something that you've actually completed and you're really just focused on maintaining the progress that you've already made? And then it lists a number of common strategies or actions and asks you to consider whether this is something that's a low priority for you, something that you'd like to do, something you've started but maybe you need to do a little bit more work on, or something that's pretty well set and that's not really where you need to focus your energy for future steps. So after we've done the assessment phase, then we move into the actual convening of stakeholders. And one of the first things that we do in the convening is we focus on the big picture, trying to identify community values, visions, and goals. And in this case, we feel it's really important to make sure that all segments of the community have a voice in the discussion. And we know this can be really one of the most challenging aspects. You can go into a room and say, is there anybody here that can't hear me? And you're not going to get the answer that you want. So we spend a lot of time with the community to make sure that they can ask themselves, who's not here, whose voice haven't we heard, and what might we do, what strategies can we employ to get those people to the workshop so that they have a say in what the community is going to look like. And we go through, once we have people there in the room, hopefully that part has been successful. We have a broad cross-section of the community. We ask people to share their thoughts with exercises, and a few of those are laid out in the toolkits. Then we spend some time on defining their community goals. This is part of defining the scope. It's not just geographic scope, but it's also the scope of the goals that you're going to tackle. And we always go in with some draft goals for the people in the workshop to respond to, just for efficiency's sake. That's a pretty time-consuming process, and we find that if we can have something for people to react to, it can move ahead much more smoothly. Next, we look at identifying different assets and barriers. The action plans are really asset-based plans, and so we recognize that the plan is going to be strongest if it builds on those things that you've already identified as strengths in the community, things that people love, and also addresses the different barriers to achieving the goals. And barriers are really important to understand. I mean, you can think of the different barriers to downtown revitalization. It could be anything from outdated and undersized retail space that doesn't meet the needs of current businesses, lack of residents that live nearby that could support that kind of retail you want, absentee property owners that are uninterested in investing in upgrades. We often see that downtown businesses might have been inherited by 12 siblings. They can't get together, don't know what to do. Sometimes there's lack of wayfinding. You have lots of people that are driving through downtown. They don't know that right off the main strip there's a great coffee shop because there's no sign to tell you to go there. And sometimes people just don't have good transportation options to reach downtown. Maybe it is within walking distance, but the sidewalks aren't safe and comfortable to walk on. So obviously these barriers are going to require really different types of interventions. And so understanding what the nature of the barriers are is going to be critical to making sure that the interventions you develop are going to address the root causes. We've seen things like downtowns having something like a facade improvement program that just goes unused, that it's not the current barrier to downtown revitalization. And so it's ended up being wasted effort. Certainly not in all cases, but that is the reason why it's important to do a little bit of thinking and planning ahead of time. And then after identifying the assets and barriers, it's important to do some brainstorming and prioritizing the actions. Brainstorming as a group obviously helps bring up new ideas. That's the whole point of brainstorming, helps you understand that where people agree. And it also helps increase the sense of ownership over the plan. If you've done your work with the outreach and you have a broad cross-section of voices in the room, and then those people get to see that their ideas are ultimately incorporated into the plan, you will get a greater sense of ownership and people that want to make sure that it's implemented. After brainstorming, the first reaction is usually that people are completely overwhelmed, don't know where they would possibly begin with this whole host of ideas. And so we need a systematic way for prioritizing actions that helps to make them more manageable. And we go through then some kind of a dot voting or some sort of system in the room so that the group can come to consensus on what's most important. Trying to move the slide. After the brainstorming, then we do what we call our action planning process. This is where we're working with tables, everybody around tables to try to fill in the action plan. We're identifying specific actions. We're saying why we think they're important, looking at different ways to measure success, something that's doable and achievable, whether that's new people who visit downtown during certain hours, like a farmer's market hours, something that's realistic to measure and track. Look at what the time frame is. We think of this process as most suitable for an action plan that's in about the 2-year time frame. And then we want to identify a lead for all of the actions, and that's really important to be somebody who's there in the room. And it may just be that lead person's role is to go out and recruit the person who's a more appropriate lead. But the action planning process is really about empowering the people who are there to do what needs to be done to get the work completed, not about creating a to-do list for people who have not yet even known about the process or bought into it. The supporting cast are all the people that can help. The workshop process is a really great way to recruit people to help with these different plans, and then start to identify costs and what appropriate resources might be brought to bear on it. Is this something that is going to require simply time? And if time, is it something that people can do as part of their jobs? Or are you really looking at an all-volunteer effort, which will influence what an appropriate time frame is? And then is it resources? Is it something that you're going to need money for? And if money, or do you need grant resources, or might you be able to get a loan because the project that you're talking about could generate some income for repaying a loan? After the community process and after the convening process and having created the action plan, we like to spend some time thinking about how it is that you can maintain momentum for the plan. And so we work with communities to talk about different strategies. The first are all the different ways that you might share the action plan. Number one is just to circulate it to the people who were at the workshop. And that seems really obvious, but I think we were working for quite a while before we realized that that wasn't always happening. And so we make sure that that happens now, and can't emphasize enough that if people have spent their time to come out and contribute to a process, they really want to see that something came of it. A number of our communities one of our communities gave us this idea that a number of our other communities have adopted because it was so successful, and that was to have an action plan launch party where people come together, usually around food, as a way to say, here, we're set, this is what we have on our agenda, who wants to help? Do anything that you can to invite more people to participate, create an executive summary, recognizing that even an 8 to 10 page action plan is not going to be read by many people who are decision makers in the community. Add it to the agenda, meaning the agenda of any relevant meeting, city council meeting, neighborhood organization meeting, church group meeting, anybody that might have a role in the plan, make sure that they know about it and talk about it. Press releases are obvious things to do. And then also sustain community engagement. The first one being continue to meet. If you've had a group of people come together as a formal steering committee to plan the workshop, then just maintain that and continue meeting afterwards. Keep community communication flowing and celebrate achievements. A lot of communities seem to want to wait until they have something like a big ribbon cutting to let people know what's going on or to celebrate it. But we think that all of the interim steps along the way should be celebrated. Maybe you've just gotten a permit approved, or maybe you've succeeded in actually having a meeting and getting the right people in the room. All of those things are worth noting, communicating, and celebrating. These are a number of the other things that we have included in the toolkit. So it's really all of the materials that we use as templates when we go into a community and start this process from scratch. We're sharing all of that here for anybody to take and to use. So just to kind of recap where we are, we have three programs that are worth highlighting here. Local Foods, Local Places is the one that was the basis for the toolkit I just mentioned. We are just starting work with communities for the 5th round of the program. We're hoping to have a press release soon announcing who those communities are. The workshops will be happening this summer and fall. And we don't yet know if there will be a 6th round, but if so, that application period would be in the early fall sometime. Healthy Places for Healthy People, the program that Stephanie spoke about, is hoping to announce another round of assistance for communities to apply again in the fall. So that would be similar timing to Local Foods, Local Places. And then most importantly, I would say, because we now have an open application, is our new recreational economy for rural communities. This is a very similar planning assistance program to the other two, using a similar model. The difference is the focus, this one being aimed at helping communities leverage outdoor recreation to revitalize main streets and downtowns. There is an open application, and they are due May 31st. So I think with that, we will wrap up and see if there are any questions for all of us. So thank you.
Okay. Excellent. Thank you so much, Melissa, Stephanie, and Chitra. Couple of questions have come in, and I'm going to say to the audience, please send us more. So what level of coordination with local government do you employ when you go through these technical assistance processes, and do you discuss the approach with them beforehand?
We always try to coordinate with the local government. So even if our main applicant is a nonprofit organization, we like to bring somebody from the local government into the steering committee. So bring them in from the very beginning. That really helps generate buy-in from people who are there, and making sure that the community isn't proceeding down a path that's just never going to gain support from the government. So that's our goal, what we always aim to do.
And as Melissa said, our steering committees are ideally comprised of a really broad range of stakeholders, but any one member of that potential steering committee can apply for the assistance. So a local government certainly can be the lead applicant. They don't have to be. It could be a nonprofit organization or a business or any number of community partners, but we are generally looking for communities to think through who are all of those partners who need to be at the table in the steering committee, as Melissa kind of talked about in the toolkit. it's important to make sure you have all those partners involved, including, of course, local government.
Excellent, thank you so much. And one of the questions that we've received from folks is whether you'll receive the slides after the presentation. Yes, we will absolutely send those around. And so you will have access to all of the links and material there. Any suggestions for people who might like to work with programs like this in a professional capacity?
Do you mean as providing the assistance? I'm not sure. Sometimes we do get that question of who might provide the assistance, and we do use contractors with our programs to help that, and we do that through a competitive solicitation process. Don't believe we currently have one open for that, but it is something that, you know, periodically we do reopen for other technical assistance providers.
Okay. Great, thanks. One more question. What's the first step to requesting assistance, and what is the smallest size of community that you will assist?
So our application process is pretty much the same for all of these programs, and it's really a very simple application. And if you're interested in seeing it, you can go to the link that Melissa provided in the previous slide, which is our Recreation Economy for Rural Communities program, and that's the one that has a current application period open. It's really just a 2-page letter of application. It's very simple. It's unlike a lot of other federal opportunities. It is not a grant. It's an offering of technical assistance, and so it's a pretty simple, streamlined process, and we intentionally make it so that it's easier for communities to apply. And you'll see the types of questions that we're asking are to demonstrate need, to talk about the partners who would be involved in shepherding the process along, and really how this fits into your vision as a community. So it's a pretty simple application period or process, and again, you can take a look at the Recreation Economy for Rural Communities application to give a flavor of that. And then in terms of the size of communities, we really don't have any limitations. We've worked in extremely small communities up to very large communities. I know I've worked in a community in northwestern Pennsylvania that only has a couple hundred people, and we've worked with very large cities as well. The Recreation Economy for Rural Communities program will have a bias towards smaller places, but really any community can apply, and that's true for Healthy Places for Healthy People and Local Foods, Local Places as well.
The only thing I'll add, this is Chitra, is that we love that we have this toolkit available for you all and anybody who could be a technical assistance provider, because that actually expands the opportunity for any community. If you can find some funding to be able, if you want a professional facilitator, a professional technical assistance provider to help you, and you're not able to get assistance through one of our open application processes, that with that toolkit and other resources that are similar, there's nothing stopping you from being able to get that kind of assistance from another provider.
Okay, excellent. Thank you very much. Questions are coming in fast and furious, so I'll throw out several more. Could you talk a little bit about some of the overlap and or differences between the work of the Office for Community Revitalization and other EPA offices like the Office of Environmental Justice or the Brownfields program?
Sure, I'll take a stab at that. So while I think the Office of Environmental Justice typically has a strong focus on working with community-based organizations that have a lot of capacity needs, and typically working a lot with giving grants to those communities to help build that kind of capacity. We tend to work using these methods, these planning methods, providing contractor-led community assistance, where, as Melissa was pointing out, we tend to recognize that development decisions need some sort of buy-in from local government or other stakeholders who have decision-making roles in the community, that we tend to bridge between organizations, nonprofits, and other community-based organizations and those governmental entities or other decision makers. That is one way to describe sort of what some differences are, but there is overlap in the sense that anytime there is a community that has disproportionate impacts of environmental concern or environmental concerns, like in environmental justice communities, that they have a development decision and they want help with that, we would very much be interested in working in those communities, and we do work in those types of communities. We have a lot of we have a lot of interest, and we have worked in a lot of economically distressed places. They don't always have that sort of concentrated environmental issue that's pointed out, that's created the need for organizing that may be the case in some of those environmental justice communities. And then on the brownfield side, I would say, many, if not all of the communities we work in have brownfields concerns or potential contaminated sites that they have some concerns over. And we tend to work very closely, especially with our regional staff in the EPA regional staff in the brownfields office or a brownfields program, to provide our kind of technical assistance support. And that's true, I think, also of there's many communities that have received brownfields assistance or grants. I think primarily what we try to do is bring a broader vision or broader community context discussion to the table, while some of the, I think, brownfields programs might be a little more tailored towards site-specific development decisions and really get into the details about like financing redevelopment projects, in addition to the ideas around cleaning up contamination on those sites, assessing and cleaning them up.
Great, thank you very much. Given that we are already a little bit past noon, I think what we'll do is I'll throw out one more question, but then we will go ahead and send any unanswered questions over to our colleagues at the Office of Community Revitalization, and hopefully the conversation can continue from there. So, final question. I live in a community with planning fatigue, writes Rachel. Much of the information that would come from this process has been identified, but never in a collaborative process that bridges the various sectors like health, food, and the economy. Is there still value in bringing folks together to map the issues or barriers and to reboot enthusiasm and rebuild buy-in?
Yeah, I mean, I would say, Melissa hinted at this, that we've worked with a lot of communities who've experienced that exact planning fatigue. And I think the power of this approach that we've been able to develop hand in hand with communities over the years is that it's very tangible and action oriented, and it can serve to reinvigorate people in the community. As part of the assessment phase, we very much look to the planning that's already been done, but we focus very specifically on where the community wants to take their community in the next 6 months to 2 years. It's a very short-term actionable process, and I think that helps to invigorate people. So this is not a replacement for long-term comprehensive planning or transportation planning. It's really, I call it catalytic planning, really focusing people on an issue that's really powerful. And I would say food and health, and we hope outdoor recreation, are all issue areas that kind of bring people together, are positive, are generally non-controversial, and generate enthusiasm. So I would say yes, of course we're biased because we like this approach, but we think we've seen a lot of success in communities who've taken this more short-term planning approach.
Great. Well, many thanks to all of you, Stephanie, Melissa, and Chitra. I'd like to encourage all of our listeners to please keep an eye out for the survey that you'll be receiving following this webinar. Please fill it out, let us know what you thought. And many thanks again to the Office of Community Revitalization for joining us to talk about your programs. I think we'll also be circulating a recording of this webinar along with the slides. So all of this good information is about to be on your desktop in short order. And we look forward to seeing where this takes a lot of excellent projects and exciting community discussions. So with that, we will sign off. Thanks again to our speakers and to our attendees. We will see you on our next National Tab webinar in the near future. Have a good afternoon.
Thank you.